there's nothing better than your tooth. Your natural tooth is the best. And I know many of us aren't in that situation, but this is why I love hydroxyapatite, because if we can heal that area or at least freeze it in time and monitor it, I mean, what a better way to go than all these surgical treatments.
Welcome back to another episode of the Peak Performance Life podcast. Today, I am very excited to have an expert in a very, very hot topic right now, the hot topic of oral health. We have Dr. Staci Whitman, who is a functional kids dentist in North Portland, Oregon. She's the founder of NoPo Kids Dentistry, where she takes a whole body, holistic, and functional approach with her patients. Her dentistry practice is grounded by science and powered by love. She attended Tufts University School of Dental Medicine and worked as a general dentist for 2 years before earning a certificate in pediatric dentistry from Oregon Health and Science University. And she has always been passionate about children's sleep and airway health as well, focusing her research and residency on how to improve airway assessments and diagnostic tools in the pediatric population. Really interested in talking a little bit about that as well, because from what I've heard over the years, there's a lot of dental work that's done that is just concerned about how it looks, but not concerned about actually how it affects the rest of the body and the person's health and life. So really interested. Dr. Staci, thank you so much for joining us here today.
Yes, thank you so much for having me. I'm always game to talk about oral health, so thank you for giving me the opportunity.
Yeah, absolutely. Let's start with a brief kind of background of how you got to where you are today with what you learned in dentistry and why you kind of have decided to operate your practice and do the things the way that you do it now.
Yes. So I was traditionally trained, as we all are, and I do think that's important to say that we all need a traditional dental training. However, I got out, I was an adult dentist for many years, which is why I don't only speak to pediatric dentistry. I speak to every human can be impacted by oral health issues. So I speak to all audiences. I was very dissatisfied with my career. I did not like dentistry. I felt like I was constantly just putting out fires, but never really addressing the root cause issue. Why were patients so unhealthy? Why was there so much decay, gum disease, periodontal disease? And I almost left dentistry. And so I thought, gosh, how do I salvage this career? I'm going to get upstream root cause as much as possible. That's with children. That's with educating parents, and that's with encouraging and educating children about the importance of oral health, that it's not just an afterthought, that it really should be, I believe, the center of your health. It is the gateway into the body. And I believe all health does begin in the mouth. We can see so much about a patient's health by just looking in their mouth. So I decided to go back to school. I went and got my pediatric certification. So I am board certified in pediatrics. I ventured out into the world as an associate and found the same thing was happening. It was just turn and burn, kind of mill style dentistry. I didn't really have enough time to work up my patients, educate, and really get to the root cause. And I realized about myself, I wasn't as into the fixing the tooth as I was about the figuring out what happened to that patient so they ended up where they were. And I think this is important. I do believe dentistry needs at some point to have subsections and subspecialties. You know, we need dentists that fix teeth, so like more tooth technicians, if you will, or surgeons, but then we also need tooth physicians. You know, we need people that are able to work up patients and understand the oral systemic connection, how airway health and the oral microbiome impact whole body health. So I decided to open my own practice, and it's been a slow evolution, and I've kind of piecemealed together my own personal curriculum so that I could practice this way, basing much on the principles of functional medicine. I am one of the only dentists in the world that's trained through the Institute for Functional Medicine. I have my certification. And because of that, we've actually joined with the Institute for Functional Medicine, and I'm co-founded in launching the Institute for Functional Dentistry, where we hope to bring dentists through to get trained. So instead of having to piecemeal their education, as I did and many others that are practicing similarly to me, there's one standardized, centralized place they can go and become educated so that patients and consumers have more access to care for these providers that are just thinking outside of the box and really looking at the whole human, the oral systemic connection, and working patients up as bio individuals and not treating everyone the same.
Yeah, I absolutely love that. That sounds amazing. And yeah, love treating the whole body, looking at it in a functional way like that. I think that's really important. And so I do have a question for you then, because you mentioned, looking at, and I think this is really the most important thing with anything. It's like, because you can go to a dentist and they can clean what you have, and then you keep doing the same things, and then it comes back, or whatever the case may be. And so everyone's like, oh, I get my thing cleaned, but okay, but what's the root cause of whatever potential issue? And maybe people don't even think they have an issue, but I guess what are some of the things then that people are doing wrong? I guess what's ruining their oral health? Maybe let's start there.
Yeah, I mean, to me, it's foundationally, it's the microbiome. So we know ancestrally our microbiomes are very different than they used to be, both our gut and our oral microbiome. So this is one thing I want everyone to take away from this podcast and this conversation, is that you need to know what's going on with the microbes in your mouth. Just as now many people will gut map and test their gut microbiome, we have to be testing the oral microbiome. It impacts and influences so many systems in the body. You're swallowing 2,000 times a day, so that bacteria can impact your gut health. But it also, we know the bacteria themselves and some of their byproducts, their cell walls, the toxins that they excrete, it leads to systemic inflammation. They can travel throughout the body, and we know that they can contribute to things like Alzheimer's, dementia, autoimmune disease. It can impact fertility, your pregnancy outcomes, autoimmune diseases, arthritis, and cancers too. So like F nucleatum is a bacteria that's associated with colon cancer, pancreatic cancer. I mean, who knew that? Like we're wondering why cancers are on the rise. Well, this is something to look at. Microbiomes have shifted. So I think it's really important for people to know the importance of the oral microbiome. But I would also say nutrition. We tend to blame that it's about hygiene and maybe the oral healthcare products that you're using. Those things are not nearly as important as what you're eating every day, what you're drinking every day. So are you nutritionally optimized? Are you getting enough fat soluble vitamins? Are you mineral deficient? Vitamin D deficiency and magnesium deficiency and vitamin K deficiencies are very linked to oral disease. Vitamin C deficiency, think scurvy, that's gum disease. Okay, so it's very nuanced and there's a lot to it. And then, as we mentioned earlier, airway, how are you breathing? So some patients can be doing everything correctly. They feel like they're nutritionally optimized, but maybe they're mouth breathing. They have open mouth posture throughout the day, or they're mouth breathing. And it's important to know this isn't just obstructive sleep apnea. Obstructive sleep apnea is end stage disease. Airway issues are on a continuum. You have to start somewhere, and it usually starts just with open mouth posture and mouth breathing. That can then translate to sleep disordered breathing and all the way now to obstructive sleep apnea. But if you are breathing through your mouth, you are losing the integrity of your saliva. It's called xerostomia. Dry mouth. Patients with dry mouth, they will have profound dental disease. We see this in cancer patients undergoing radiation and chemotherapy and on certain medications that impact salivary health. Like our saliva is this golden elixir of our bodies that we should take very seriously. And on top of that, mouth breathing, it will change the pH of the mouth. So acid is detrimental. It's truly acid that causes disease in the mouth. It's not sugar, it's acid. So pH will drop when you mouth breathe. So now you have this acidic environment. Pathogenic bacteria love acid. That's where they thrive. They can proliferate and essentially take over. And so they end up crowding out all the beneficial bacteria. So you have dry mouth, acidity, pathogens. And until you get your mouth breathing and airway issues addressed, it will be an uphill battle.
Yeah, that's a great point. And we've had breathing experts on the podcast as well, talking about the importance of breathing through your nose as much as possible, especially when you sleep. We had the guy from Oxygen Advantage who wrote the book, The Oxygen Advantage.
Oh, Patrick?
Yes, we had Patrick on. He's great.
Yes, he's a friend. He's
Y-
amazing. Yeah, so he probably
Yes.
talked about mouth taping and sleep
Yeah,
taping.
so we
Yeah.
we actually, my wife uses his mouth tape sometimes
Yeah.
because she found that she was like getting dry mouth or whatever,
Mhm.
little mouth breathing, and she's using the tape. It's a wonderful mouth tape. For those who
Yeah.
haven't heard the episode, you can go back and look for Oxygen Advantage or Patrick McEwen
McEwen. Yeah.
McCown, and so yeah, he has a mouth tape though. I think it's called Myotape if anyone
It
wants to
is.
find it on Amazon, but it's
Mhm.
basically like a mouth tape that has a hole in the middle though, which kind of relieves a lot of people's anxiety about using mouth
Mhm.
tape. Like I know a lot of people are like, "Oh, I'm afraid to tape my mouth shut. Like,
Mhm.
what if I need to breathe or something?" It's like, well, this one actually has an opening. If you really needed to open your mouth, you could, but it does kind of purse your lips closed. So I think it's really the best mouth tape out there, and it's been effective. But yeah, I didn't actually connect. I've always thought about mouth taping and breathing through the nose from an oxygen and a health perspective. I never thought of it though from an oral microbiome and dry mouth perspective, and how important that is as well.
Yeah. Yeah, your mouth is meant to be moist. It's meant to be neutral, if not alkaline. That's where commensal bacteria thrive. That's when beneficial bacteria thrive. Um, our saliva is profoundly important. It's actually what protects your teeth. I mean, our saliva is what has so many minerals in it, and it's where a lot of calcium and phosphorus exchange happens, lubrication. And so, if you lose your saliva, your teeth will just crumble. I mean, we see this with patients with Sjogren's and autoimmune issues that affect salivary health. If they have salivary tumors, certainly if you're undergoing radiation, chemotherapy, certain medications, as I mentioned, can lead to xerostomia. And xerostomia is detrimental. And think about mastication and chewing and the ability to swallow and digestion. Like your saliva is actually incredibly important. And it's something we just don't even think about. So you want to be hydrated, you want to be mineralized, you want to make sure your saliva is optimized.
Yeah. And with the oral microbiome, are you using with your patients ever one of these oral microbiome tests or the pathogen
Yes.
test, the oral DNA and those kind of things?
Yes, I do. I There's a couple different tests I use. I don't use oral DNA in my office. Oral DNA tends to target on like the top dozen or so periodontal pathogens, which is very
Mm.
important, I think, in the adult population. But I really like a brand called Bristle. They use shotgun metrogenomics to assess all species of the mouth, the entire DNA sequence. So not just the top most virulent pathogens, because there can be outliers, and we are missing these. And it will also test for Candida. Fungus is a big culprit in dental decay, especially in children. And many people just blame Streptococcus mutans, but we know many of these pathogens work synergistically. So if you have strep mutans and Candida, I mean, this is where we get rampant decay in children. So
Mm.
we will use a bristle test, but also there's a test called SILHA, and this isn't truly mapping the microbiome, but it does test biomarkers in the saliva to assess for acidity, leukocytes, if there's blood in the saliva, which can indicate inflammation. It will test the pH. It will look for carcinogenic bacteria, etc. And so it's a great tool, and it's an educational tool too, because it gives us a place to start the conversation with the parent to say, like, your child, they're very acidic. Like, why is that? Why would saliva be acidic? Well, it can be a sign of dehydration. It can be a sign of mouth breathing. It can be a sign of your nutritional status too, gut health imbalances. Maybe they're what type of foods are they eating? Are they snacking and consuming a lot of ultra processed foods throughout the days? This can shift the pH of the mouth. So we
Mm.
speak a lot to the importance of not only what you eat, but how you eat it. It's important not to sip and snack all day. You should eat on a schedule.
Mm.
If you're constantly sipping and grazing, every time we put something into our mouth besides water, the pH drops. So your mouth becomes acidic when you put food or drink in there. It's part of the digestive process. So the enzymes come in, the pH drops to break your food down so that you can swallow and carry on with your day. But if you're never allowing your healthy saliva, hopefully, to remineralize the teeth to kind of buffer that acidity, you will be constantly in the state of acidity. And so that is also where we see a lot of issues with patients. They might feel like they're eating pretty well and their hygiene's okay, but then we find out, well, they drink coffee and they do put sugar in their coffee and they sip their coffee for the first 4 hours of the morning. So they're just constantly bathing their teeth, not only in the acidity from the coffee, but now the sugar is going in there and the pH is being affected. So we like to try to teach patients on the importance of giving your mouth a rest. You have to let it rest so your saliva can come in and do its work.
Yeah, and as you say, acidity, it makes me think of I was in a room with a bunch of business people the other day, and everyone's talking about how they're interested in being healthier and improving their lives. And then I look around the room, and more than half the room is drinking a Coke Zero.
Yeah.
And because there's 0 calories, or because it's a diet soda, and you think, oh, it's no calories, right? I'm not going to gain weight. It's okay. But I think these are some of the most acidic
Yes.
things that probably I would imagine would be really bad. And in fact, when someone usually is drinking this thing this stuff all day, and then you have a conversation with them at the end of the day, sometimes you're like, whoa, your breath doesn't smell too good here, buddy.
Yep.
So I would imagine those would be pretty detrimental. That's one of the things. The problem with these Coke Zeros and stuff is that people are like, oh, there's 0 sugar or 0 calories, so it's okay. But I imagine, especially when oral health comes into play, it could be really detrimental.
Absolutely. Yes, you're spot on. And it's because, unfortunately, dentistry hasn't done the best job about educating patients on the root cause. I mean, all we talk about is sugar and brushing and fluoride, but it's so much more than that. And it really is acidity. So you're absolutely right. I mean, Coke Zero, okay, it doesn't have sugar in it, so your blood sugar may not be impacted. But what about all the other things in it? Not only the acidity of it, which it is an acidic drink, you're absolutely right, but what are the other ingredients, the coloring, the preservatives, what are they doing to the microbiome? Everything you put in your mouth has an influence on the oral microbiome, including a filling, a retainer, a mouth guard, everything. So it's just like we say, what you put on your fork influences your whole health. What you put in your mouth influences your whole health, like from an oral health standpoint, just because of this acidity and oral microbiome influence too. So a lot of this is just re-educating. And again, thanks for this opportunity. I hope listeners take a lot away from this, but we really want people trying to eat and drink on at least every 2 hours. And in between trying to just drink plain water. And people speak, what about all these electrolytes? I mean, you need to know what their acidity is too. A sprinkle of salt, I'm not worried about it, but some of these electrolyte powders, they have citric acid in them. They have natural flavors that can impact the microbiome too. So it's kind of a mindset shift to just say, how is this influencing my oral microbiome? And the thing is, we're all bio individuals. So there's some people out there who have great oral health no matter what they do. There's epigenetics at play. There are they probably were born with a really wonderful microbiome, and their salivary health is on point, and they can get away with this. But if you're out there listening, and saying, "Gosh, my oral health, every time I go in, I have a cavity. Every time I go in, I have gum disease. No matter what I do." I mean, you need to be thinking about some of these other strategies.
Yeah, that's a really, really important point. Good point there. So I want to ask you about this new ingredient. Well, maybe it's not so new. I've been hearing about it recently, and again, I hadn't heard about this ingredient up until about a month ago. And then in the last month, I've now it's come up like literally in the last month, like 4 or 5 times. And then in doing my background before this episode, I noticed that it's one of the ingredients in the toothpaste that you're affiliated with as well. So let's talk about, am I pronouncing it correctly? Hydroxyapatite? Is that how it?
Yes, hydroxyapatite, like your hungry appetite. Yes.
Yeah.
Yeah, I can speak a lot to this. I know a lot about it. So hydroxyapatite has actually been around since the 1970s. It was developed as part of the space program because they realized when astronauts went out into outer space, they were losing minerals. And so how do they counteract this? They developed hydroxyapatite supplements, and they were putting it in oral healthcare products too. And what is it? It's essentially calcium and phosphorus. It's important to know that your enamel And is your enamel is primarily made of hydroxyapatite. About 97% of your enamel structure is hydroxyapatite crystals. The dentin, which is the layer below the enamel of the tooth, is about 60% or so. And our bone is made of hydroxyapatite also. And hydroxyapatite is used a lot in medicine for grafting in various surgeries too. It can be used in pharmaceuticals and for carrying agents, etc. So that happened. Japan actually, interestingly, caught wind of it and grabbed it and patented it. So this was in the early 80s. And so hydroxyapatite has been the primary remineralizing ingredient in Japan since the 1980s. So they were the OGs. It came to the United States in about 2015, was when it kind of started sprinkling in. It's used in many countries in Western Europe and Italy and South America too. It has been before here, but you're right. It is kind of starting to become more popularized, but it is biomimetic, meaning it's very similar to what is already in our enamel. And so if we have deficiencies in our saliva, if we're calcium, phosphorus deficient in our saliva, or we have demineralization or loss of minerals in our teeth, this can be a wonderful protective boost. And so it's a fluoride replacement. The studies show it actually works just as well as fluoride. There are some studies that show it outperforms fluoride. There's microhydroxyapatite, there's nanohydroxyapatite that has to do with the particle size. The studies support this, and I see this clinically. Nanohydroxyapatite works much better because it's small enough to get into the tubules of your teeth, to actually get in there and fill in any demineralization or defect, and then it will occlude the area and smooth the surface. So because of that, it not only can remineralize small cavities or demineralization areas, it can arrest or freeze cavities, but it helps with sensitivity. So especially as we age, some people have these little spots that just zing and have a lot of root sensitivity. It is a miracle for that because it's occluding. And it has to do it can change like fluid dynamics and things within the tooth also. And because it's smoothing the surface out, a lot of people report, and there's studies to support this as well, that they can whiten and brighten teeth because it's creating a smooth surface. So the way that light reflects and refracts off your teeth, it looks brighter and whiter. It is important to know that so this became really popular in Europe. And about 7 years ago, the SCCS, which is the Scientific Committee for Consumer Safety, kind of caught wind of it. And we know the EU standards are pretty strict. And they said, not so fast. We need to dig into this nanohydroxyapatite because we know a lot of other nanoparticles like nanosilver and nanometals have been banned in cosmetics, etc. Toothpaste is considered a cosmetic. So they studied it. They studied it for over 7 years. They did in vivo studies, in vitro studies, human trials. They looked at all the data since the 1970s, all the Japanese safety studies. South Korea has a lot of studies too. And they determined there's certain criteria for the particle, how it's manufactured. And this is a good thing. We want standardization and safety. We don't want things just being pumped out of manufacturing facilities from places that might be high in contaminants and heavy metals. And so they listed this criteria of what needs to happen with the manufacturing process. And unfortunately, they only found one manufacturer in the entire world that's following the criteria, and that's the one they approved. So it's Fluidinova out of Portugal, and they make a particle called nanoxim. It's NANOXIM, and it's bioidentical. It's incredibly pure, and it dissolves completely in your saliva and in your stomach acid in minutes. So it basically supercharges your saliva. And the research on nanoxim is profoundly impressive. It's actually, there's more and more coming out that's getting published and presented because the particle is so pure. It's really impressing a lot of people in dental materials. I will tell you, clinically in my practice, I see kids' cavities reverse, remineralize, disappear. I'm avoiding so many fillings and anesthesia visits for my patients because of nanohydroxyapatite. And I really hope more dentists start being open-minded to this, because especially as many people become more cautious with fluoride and looking for alternatives, this is in my opinion, not only an equal alternative, I think it is a better alternative. One thing about fluoride, I mean, we can get into all the health concerns, but something very few talk about is that fluoride is antimicrobial, but it's not selective. And so my question is, what is this doing to your healthy bacteria when you're putting this, antimicrobial into your mouth every day? We know we're like with mouthwashes, the whole anti-mouthwash conversation, because of alcohols and astringents, it's carpet bombing your mouth. It's affecting nitric oxide pathways, which can affect your blood pressure and lead to cardiovascular issues. Well, it's the same with fluoride to a degree, and it might be a lesser degree, but I'm just so curious, like what the cumulative effects are. And then certainly if you're ingesting it, what is it doing to the gut microbiome? And these are conversations that we need to start having. We need more research about it. But for anyone who chooses to avoid fluoride or really just wants biomimetic materials, I do encourage you to look into hydroxyapatite.
Amazing. Yeah. And so the brand you mentioned is a brand for people maybe out in Europe. But you also have a toothpaste as well, right? That you and another doctor created.
Yes, it's not the brand. Nanoxim is the
Oh, the
ingredient.
ingredient. And is
Yes,
that
so
the
it's
ingredient that's in yours as well?
exactly, yes.
Oh,
My
awesome.
brand is called FIG, FYGG. It stands for Feed Your Good Guys. And the reason we called it that is we wanted to be an oral microbiome focused oral healthcare line. So we do have this really incredible remineralizing agent in there, Nanoxim. Um, and we're very impressed with some of the comparative and clinical trials that have come out. But more importantly, what we wanted was a product that focuses on the oral microbiome. So we took out all the emulsifiers, the surfactants, the essential oils, the additives that can alter and shift the oral microbiome. And so many people don't think about this. We think of essential oils are good, right? They're antimicrobial. So you do not want to be using these every day in your mouth. They can be good for acute issues, but not long term. It's the same with things like coconut oil. Coconut oil is a very low antimicrobial. So that was the hardest part about developing it is every ingredient had to be very thoughtful about how is this impacting the microbiome. And what we did also is we added prebiotics and amino acids into it that the data has shown actually can modulate and shift the commensal and beneficial bacteria. So it's essentially kind of like a supplement. So it's remineralizing and strengthening your teeth at the same time. It's boosting and feeding your good guys. It's helping your healthy bacteria. And we've had a lot of success with it. We just launched about a year ago, and the feedback has been really wonderful, not only from consumers, but from dentists and hygienists, what they're seeing in their chairs.
Amazing. Amazing. Yeah. Shout out their website real quick while we're talking about it.
Yeah, it's fig.com, FYGG.com. I actually have a code for you, PEAK15, PEAK15. So if people want to check it out, I would be very honored. And please let me know what you think, but it will give you 15% off.
Amazing. Amazing. Yeah. I mean, it sounds like an incredible ingredient that, again, if you can reverse anything that can, you say reverse cavities, that's, or remineralize or do things like that without the side effects of a fluoride. And yes, what you just mentioned, actually, I just wanted to ask you about that. So I've actually been I bought this little one, you've probably seen the one that went viral, but some coconut oil pulling that has some peppermint in it and,
Yeah.
the whole deal. And I'm like, oh, this is great. Now, I don't have to use a mouthwash. I'll use this coconut oil with a little peppermint oil with a little bit of, all these other all natural ingredients. But I hadn't really thought about the fact that they could be affecting
Yeah.
because they're, tell me a little bit more. So should we be careful with this coconut oil pulling? Do you recommend coconut oil pulling at
Yeah.
all?
I do. I oil pull. I'd be cautious with that peppermint oil in there. That's what concerns me more. But I do oil pull, but I don't do it every day. I do it once or twice a week. So I think it's just more moderation. My approach to oral health is less is more. And so I know people really want that foaming, burning, minty sensation. I encourage you to try to have a mindset shift and allow your oral microbiome to adjust. So that burning is carpet bombing your mouth. Now, a lot of people will say, but I have bad breath. My argument would be the mint is just masking that. There's something else going on in your body if you have halitosis or bad breath. Do you have periodontal disease? Do you have gum disease? Are you tongue scraping? Are you cleaning the tongue? Are you mouth breathing? What's going on in your gut? Like odor can come up this way. It can come from the sinuses. So again, from a root cause perspective, we really shouldn't have chronic bad breath. Do you have tonsil stones? So let's unpack that. But I'd be cautious with essential oils. We don't want the burn or the foam. So I'm okay with oil pulling, but I don't think we need to be doing it every day.
And
The
you would do
other
it with
thing,
just straight, pure coconut oil, nothing else.
yes, raw organic coconut oil is what I use.
Interesting.
The other thing too is when you start to use a cleaner toothpaste, you will notice a shift. There can be a transition period because you've been keeping your microbiome completely out of balance. And it takes time for it to repopulate and normalize. So you have to be a little patient. I like to explain it this way, just like if and when we all moved off from the traditional deodorants, there was an adjustment period probably for you. Certainly there was for me, where my body odor had to kind of acclimate. It was my skin microbiome essentially had to acclimate. It's the same with washing our hair. We realized we were over stripping and washing. And so if you take a break and you alternate the way you wash your hair, you may find your hair gets really greasy and oily, but if you're just patient after a few weeks, some people it takes a couple months, it will adjust. And that's really what we want to be moving toward, is a more balanced, supported microbiome. So I just encourage everyone to take patience with that. But from people always ask about mouthwash. I'm not a huge mouthwash fan. Certainly, I don't want people using traditional alcohol-based mouthwashes or astringents. That prescription mouthwash, dentists write, that needs to go. They don't even use that in Europe now. I don't know why we keep using that with patients. It's just, again, it's carpet bombing. It's basically like putting a complete antibiotic rehaul in there. And so your body's never able to keep up with its oral microbiome balance. I do
Yeah,
I will say,
tongues.
I just will say, if you're going to rinse, I really just like warm salt water and baking soda or a little sprinkle of salt. Salt is antiseptic. Baking soda will buffer and neutralize. So it's going to get rid of that acidity. I mean, that's really easy to do at home. It's basically zero cost or very low cost for people. We don't need all these bells and whistles and just, I would say, save your money.
Nice. And yeah, I mean, you mentioned tongue scraping. That one to me, like some people I know recently, when I was talking to them about it, they don't tongue scrape. And I was like, what? You guys don't tongue scrape? Like, oh man, you don't know what you're missing out. I mean, you gotta be tongue scraping. You could just see all the crap come off your tongue and you're just like, yeah, well, that's not what you want on your tongue all day. So I scrape real good, and highly, highly recommend that one as well.
It's one
What
of those
else?
things, don't
Flossing.
knock it till you try it. And I really want it part of everyone's oral health care routine. It will make your food taste better. Your mouth will just feel better. So many pathogenic bacteria are living on your tongue. And people always ask, well, can I just brush? There actually is data to show scraping removes more pathogens and bacteria than brushing. If you want to use a toothbrush, you can. It won't do as good of a job, but please don't use the same brush. Like keep a tongue brush and keep a toothbrush, like you really should separate them.
Yeah. Yeah. So flossing and now like water pick kind of stuff, right? The new water pick thing that everyone's talking about. Can that replace flossing? Do we need to floss every day? I know some people are like, yes, floss twice a day. I heard another person say that who's in some sort, I can't remember what kind of dentistry he was in, but he said he actually only flosses when he has something stuck in his tooth because he doesn't want to cause micro breaks in the gum or something. So yeah, what's your opinion about flossing and how often should we do it?
I disagree with that. I think I've heard a couple of people saying this. So no, you're not, unless you're flossing so aggressively that you're cutting your gums and bleeding every day. There's bigger things that I'm worried about as a clinician than micro cuts in your gums. I want everyone flossing. I can't emphasize it enough. it's not just about removing food. Pathogenic bacteria are anaerobic. They're smart. They move around your mouth. They can move into areas of low oxygen. Where are those areas? Between your teeth, down in the sulcus, or kind of that the rim of gum around your tooth. They love to live down in there. And then they feed on the food that does get stuck in there. This is gross to think about, but this is really what happens. So when you're flossing, it's not removing food that I'm worried about, it's removing the biofilm. That's what sticky plaque is. And so the bacteria sticks in there, it adheres, it thrives because it's anaerobic, it's low oxygen. Now you're supplying it with food like fermentable carbohydrates. So if you're eating chips, crackers, pretzels, granola bars, anything besides like meat, vegetables, and that can feed bacteria too, but it's really the ultra processed foods that's doing us so much harm. We need to be disrupting the biofilm. And so I see most disease in children between the teeth. Almost all cavities I see in kids are between. So parents are doing a great job brushing, but they're never flossing. So the kids just get decay. And this happens in adults too. So I cannot emphasize flossing enough. I personally think it's more important than brushing. If we lived in ancestral times and we're hunting and gathering and didn't have goldfish crackers and Doritos and, okay, maybe. I also imagine that the breath back then was pretty funky. But your gums will be healthier. You'll be less likely to have periodontal disease. But now, speaking about water picking, the studies show that it can be pretty close to a replacement for floss. What I personally do is I floss one day and I water pick the next, and then I floss one day and then I water pick the next. Because especially as we age, we do lose some bone. And so the bacteria can get kind of further down in that kind of bone loss area. And floss doesn't quite cut it. Floss is scraping your tooth and removing the biofilm stuck to the tooth, but it maybe isn't getting the bacteria that's kind of down in that pocket. And that's where a little blast of water can come in. And I like to add a little baking soda to my water pick too. So I personally like to alternate. But with patients too, beggars can't be choosers. I just want you getting in interproximally is what it's called. So between the teeth daily. So whatever works for you, I'm okay with it. And people always say, what time of day? I prefer, you're right, twice a day would be great. At least at nighttime, so you're getting the food from the day out of the way. But again, beggars can't be choosers. If it works for you to floss on your morning commute, great. If you do it in the shower, great. If you do it on the couch while you're watching TV, whatever works for you is what I suggest. But I really want people prioritizing that. You will get healthier, I promise you, if you start prioritizing flossing or water picking.
Amazing. Yeah, that's great feedback. You could do one day floss, one day water pick at least. So what else did I want to ask you about here with regards to oral health? I wanted to ask you about the lasers. What's that?
Oh, yeah.
Yeah.
Yeah, laser dentistry. So I do use a laser in my office. I use it's called a Photona. It's an Nd:YAG and an erbium dual laser. We can do photobiomodulation, so that can, expedite healing and collagen synthesis. It will disinfect. It's a hard tissue and a soft tissue laser. So the hard tissue I use for my dentistry. So it replaces my drill. And so what it does is it actually targets water molecules. So instead of like a jackhammer just physically breaking up the tooth and leading all these microfractures, it's a much gentler way. It essentially evaporates the water within the cell, and it's much gentler. And because of it, the kids don't need injections, so we don't need to use Novocaine with it. We use a little topical jelly, but it's so great. In adult dentistry, it's just different how they use it. They can use it for fillings too, and crown preps and things. Sometimes adult teeth are a little more sensitive, so you may still need to get numbed up a bit, but it's certainly a much gentler experience than having that drill, the loud vibration. It's really, dentistry is pretty awful. I'll be the first to admit it, which is why I like to say there's nothing better than your tooth, your natural tooth. is the best. And I know many of us aren't in that situation, but this is why I love hydroxyapatite, because if we can heal that area or at least freeze it in time and monitor it, I mean, what a better way to go than all these surgical treatments. I think dentistry way over treatment plans, particularly pediatric dentistry. I mean, so many kids now are undergoing anesthesia for these very invasive procedures. And don't get me wrong, I have to do these, but you need to make the clinical decision of when it's actually essential and when it isn't, and especially with kids, the teeth do eventually fall out. Again, I don't want to be dismissive. Like, we have to treat kids' teeth and it's important, but it's also good to have a very honest conversation with your provider to fully understand where your child's at, where you're at, and what can you do besides like a surgical intervention, if anything. And sometimes the answer will be no, you have to have a filling or a crown, but there's a lot more options out there than I think are being presented to people.
Yeah, that's really interesting. So you're using the lasers instead of a drill to fix cavities and things like that. But then have you also, and you mentioned, so photobiomodulation is red light.
Yeah.
Obviously, people are using these red light panels, red light devices, red light laser caps to grow hair,
Yeah.
red light on their face to make better skin. But I did hear recently as well, someone else talk about how, if you have pathogens or some sort of bacterial infection in your mouth, you can actually use red light, or maybe it's red light and blue light or something, but lasers to kind of get rid of some of those pathogens without having to use antibiotics. Is that right?
Yes, possibly. Yeah. So the NDI component of it can be used for cleanings essentially. So you can go down in the pocket, the periodontal pocket, and it will disinfect and clean away pathogens down there. It can help recontour gum tissue, and I mean, there's so many things these lasers do now. And yes, red light therapy is certainly part of it. Using red light therapy for healing, I actually have little red light panels that if a child's had the oral surgery, and I know many biological adult dentists give this out too, that they can take home to use to expedite healing. There are red light devices now that go in the mouth that can help potentially lower pathogenic bacteria, can help with gum disease and inflammation, lead to more like collagen synthesis and healing that way too. So it's a cool time to be alive. There's so much neat technology coming out, but I'm a big fan of red light and just light in general. That's a whole other tangent we could get on, is the importance of clean light and not junk light. And there's some studies coming out showing that how that can impact obviously hormones, and dental formation, enamel formation is hormone driven. So, you can get pretty esoteric here about the importance of tying all these things together, like circadian rhythm and light early in the day and vitamin D optimization, things like that. And it can tie back to oral health, certainly.
Yeah, it's fascinating stuff. Wait, so if we have these big red light panels, should I open my mouth wide the whole 20 minutes on while I'm in front of the red light panel? Or
why not? Go for it. You can do a little pilot study in your home. Yeah, they're studying red light and oral health for sure. And there's more and more devices, but yeah, I think you'd have to get pretty close up, but why not? Why
Interesting.
not?
Interesting. So last question I have for you is actually just for, people listening right now, adults listening for themselves, as well as parents listening for their kids. They're probably wondering, they're probably thinking, okay, like, well, and of course I'll ask where they can follow you and learn more and all that in just a second, and we'll reiterate where they can buy this important toothpaste that I'm certainly going to be using. That's for sure. But they're maybe thinking like, okay, so I don't know, I just go to some traditional dentist, they just do the cleaning, I'm in and out. Like, so what advice would you have? Let's say someone's on the East Coast, you're in Portland, they have a kid, they're also concerned about their own oral health. Should they be looking for some sort of holistic dentistry? What advice would you have for them?
Yeah. Well, this is why we've created that training institution. So we're trying to solve for that issue, because you can go to a quote unquote holistic dentist and one is just incredible in doing all the things, and one is like, wow, where am I? Get me out of here. Because there's no standardization. So if you can, I would look for. I like functional dentistry personally because it's based on the principles of functional medicine. So we're looking at hormone pathways, immune health, gut health, like really like physicians of the mouth. But they're hard to find. I understand. At the very least, I think just educating yourself. So I would just try to consume as much information as possible. A lot of these things are things you can do at home. Going to the dentist is still, I want you to go in so you can make sure you're healthy. We're not missing cavities or periodontal disease, that you don't have oral cancer. That's something we screen for. You need to go in for your cleanings because that's disrupting the biofilm. But a lot of the preventative measures are things you do at home. Generally you only see your dentist 2 times a year. It's what you're doing those other 363 days that really matters. So listening and following accounts like myself, there's many other dentists out there, just trying to empower and educate yourself. But what's so interesting is what's good for the body is generally good for your mouth too. So if you're really into human optimization, if you're doing all the things, I think you're probably doing better than most. And then just trying to tailor things on with education that I'm teaching here, maybe test your microbiome. There are functional dentists out there, so you can look for them and find them. I do online consultations.
Okay.
And then don't be afraid to get second opinions. I think that's one of the most powerful take-home messages I want you to know. Even if it's been the dentist you've been going to forever, this isn't personal. It's not that they're a bad person, but maybe they're just not looking at things the way you need them to look at it. So if something doesn't resonate with you, please get another opinion, because I can say this confidently. If you go to 10 different dentists, you're probably going to get close to 10 different treatment plans. It's really that variable. Our profession is so all over the place. So you have to just build that trust. And I encourage everyone to go with your intuition and work with providers that resonate with you and listen to you and give you autonomy.
Yeah, no, I think that's great advice. And especially if people can do an online consultation with you, because man, I'll tell you, I've had a few friends who, they went somewhere and then they said, no, we got to, remove the teeth or drill or root canal or this. We start getting to the periodontal issues and now they have nerve issues and all sorts of issues. I mean, it can get really bad. You go down a bad route by not taking care of your oral health in the first place. Then, you have a dentist who decides to go with some sort of aggressive or old school procedure versus maybe if you had a second opinion from Dr. Staci, she'd be like, oh no, we can knock that out with a laser in 10 minutes,
Yeah.
And it's,
And that does happen. And I mean, full disclosure, I do consultations with kids. So 12 and under. But reach out to me. You're going to get my contact and I can connect you with adult dentists who are helping too. I mean, we approach things the same way, but I do have to limit my practice because I'm just I'm pretty busy. So I had to limit the ages. But always message me. I'm on social media.
Yeah, please share it.
Yeah, so I'm on all platforms really. I'm a lot on Instagram, so it's Dr._Staci. It's DOCTOR_STACI. I know it'll be in the show notes. I'm on X, I'm on Threads, I'm on YouTube. My website's drstaci.com. Our toothpaste is fig.com. But please, I do receive a lot of messages and emails. I respond to Instagram most readily. If you DM me, even as an adult, I can help offer recommendations, tips, things to be thinking about. And certainly, I also love to refer people to colleagues if I have connections. So please don't hesitate to reach out. I'm really here to help.
It's so nice of you. We really appreciate that. And I guess you gave a code PEAK15 for 15% off at fygg.com, where we got to get this nano hydroxyapatite toothpaste. I saw you have tongue scraper. I also saw, let me ask you real quick about your oral probiotics, right? You have on there as well. So tell us, why should people be taking an oral probiotic and why?
Yes. Yeah. So our toothpaste has prebiotics in it, which is the food to feed the bacteria, right? I do like most patients on an oral probiotic. Now, to be thorough, we really should oral microbiome test first because I want to know what your standing is, what is your diversity. I mean, if you are perfectly balanced, then the argument would be no, you don't need an oral probiotic. I certainly like probiotics through food as much as possible. So fermented foods obviously is a wonderful thing, but most of us are a little imbalanced and can use a little pick me up. So the one that is on our site, it's actually made by Bristle. So we're just, we're helping to support them. They're the oral microbiome test, but they also have an oral probiotic. It's all based on science and research. So it has all the strains that the science has shown actually influence and impact the oral microbiome. These are oral microbiome researchers. So that's why I like this company so much too. They're not like VCs that are just jumping in on the oral healthcare craze. These are actually like they're in the lab studying oral microbes and pathogens and commensals, and it's just a really wonderful company. And so we do like to recommend those oral probiotics. I actually take oral probiotics. So my routine at night is I will tongue scrape, floss, or water pick, depending what night it is, brush, and then I take my oral probiotic. And that's it. Yeah. And then I do my lip taping and all of that that we talked about earlier in the show.
Amazing. Amazing. Thank you for sharing all that. That's very helpful for everyone listening. And Dr. Staci, this has just been an absolute pleasure. You're a wealth of knowledge. Highly encourage people to follow you on social. And I hope we could do this again sometime.
Yes, I would love to. I have so much more to talk about. So I would love to be back on. Thank you for having me.
Amazing. Thank you. Thanks for listening. If you enjoyed the episode, can you please leave us a rating or review and subscribe? I've realized that while we have actually increased our downloads a lot, we're actually getting a lot of downloads, which I'm really happy about. We actually have very few ratings. And I realized that I've never asked people really to rate much. So I'm asking you now if you could please rate and review and subscribe. And if you enjoyed the episode, please forward it along to anyone that you think will get value out of this. Also, if you haven't checked out our line of products at buypeakperformance.com, you get 20% off your first order. That's www.buypeakperformance.com. We have some incredible products, including our organic high-altitude coffee. If you don't know this, coffee is one of the most heavily sprayed with pesticides out of any crop. So it's really important that you drink organic coffee. We've gone above and beyond to source what we believe is the highest quality and healthiest organic coffee in the world. We're also famous for our organic green superfood powder. You can get 20% off of that as well at buypeakperformance.com. We also have an organic vegan and paleo plant protein. See, most of the vegan proteins out there are using brown rice protein, which is really not a good source of protein, and it's also a grain. And if you're paleo, you know that grains tend to cause inflammation in some cases for some people. And so we wanted to make one that was paleo friendly and vegan and organic. We made an amazing amino acid profile, so it's really one of the best plant proteins for muscle building. So you can check out Peak Performance Organic Plant Protein. You can find that on our website. Of course, all our products are on Amazon as well. So thanks again. And again, please, if you enjoyed the episode, please forward it along to someone who you feel can get value out of it. And please leave us a rating, review, and subscribe. Thank you.